everyone, welcome to GP Notebook TV. My name is Lisa Devine and I'm a GP in Wicklow in the lovely Republic of Ireland. And I'm here to talk to you today about a journal article that was recently published in the Diabetes Care Journal, and this was published in April 2024. It looked at the really interesting topic of the positive effect of breastfeeding on the cardiovascular risk of women with either type 2 diabetes or a history of gestational diabetes. And the title of the journal article was Lifetime Duration of Breastfeeding and Cardiovascular Risk in Women with Type 2 Diabetes or a History of Gestational Diabetes, Finding from 2 Large Prospective Cohorts. So as a way of introducing the topic, many of us might know that cardiovascular disease is a leading cause of morbidity and mortality among people with type 2 diabetes and accounts for greater than 75% of hospitalisations in this group. Women with type 2 diabetes are at particular risk of cardiovascular complications. Women with a history of gestational diabetes also carry a higher cardiovascular risk, whether or not they ever go on to develop type 2 diabetes in their lives. This risk makes us very interested in any positive intervention which could reduce the risk for these women in the future. Let's have a little look at the World Health Organization's opinion on breastfeeding. So the World Health Organization strongly advocates for breastfeeding where possible, given the proven benefits in general to the mother and the child. However, unfortunately, the World Health Organization also estimates that less than 50% of postpartum women will go on to breastfeed. Now, breastfeeding is certainly a topic that I will touch on at some point in antenatal consultations with women that I'm seeing. But it's important to be sensitive. It's quite an emotive topic, and breastfeeding is not easy, so it's always important to take a holistic and person-centered approach. However, it's not a reason to shy away from the topic, and sometimes even bringing up the subject, advising about the benefits and the positive benefits of breastfeeding to both the mother and the child, and providing some signposts to educational resources on breastfeeding can be enough to make a woman who wouldn't have considered breastfeeding give it another thought. So let's go back to the study. Why was the study undertaken, first of all? Well, the authors reviewed the literature and they could see that there is evidence that breastfeeding is inversely associated with cardiovascular risk among Paris women in the general population. However, what they didn't see was evidence that looked specifically at women with a history of either type 2 diabetes or a history of gestational diabetes. And what they wanted to study was whether breastfeeding and the duration of breastfeeding had a positive effect in terms of cardiovascular risk in women with type 2 diabetes or a history of gestational diabetes. So what was the study exactly? Well, it was an analysis that was conducted on 2 ongoing prospective cohort studies. These studies were called the Nurses' Health Study and the Nurses' Health Study 2. The Nurses' Health Study, the first one, was initiated in 1976 and included almost 122,000 women who were female US-based nurses between the ages of 30 and 55. The Nurses' Health Study 2 was established in 1989 and recruited just over 116,000 female US nurses aged between 25 and 42. And what they did with these women is every second year, they would mail them a questionnaire, and these questionnaires would cover things such as reproductive status, different lifestyle factors, and health status. And they had really good response rates to their questionnaires, so the response rates were over 90%. In this particular study, what they were looking at was their primary outcome was major cardiovascular disease. And they defined this as the occurrence of a non-fatal MI, a fatal MI, a person having to have coronary artery bypass graft surgery, having to have a percutaneous coronary intervention, or a person suffering a stroke. And so what did the results show? Well, happily, the researchers came to the logical and positive conclusion that, first of all, breastfeeding was associated inversely with a risk of cardiovascular disease, and that the longer the duration of the breastfeeding, the greater the benefit, just like in the general population. They found that this was independent of other cardiovascular risk factors, including independent of body mass index, family history of cardiovascular disease, physical activity, alcohol intake, socioeconomic and smoking status. There were benefits in women who ever breastfed. However, the benefits were greatest in women who breastfed for a little bit longer, with the greatest benefits being seen in women who breastfed for 18 months or more. Among women with gestational diabetes, the benefits were seen whether or not they went on to develop type 2 diabetes. The article really nicely not only covered the what, but it also discussed a little bit about the how. And it proposed there were a couple of different mechanisms that could be contributing to this positive effect. So the first piece of information is that it certainly seems that breastfeeding favourably influences carbohydrate and lipid metabolism by mobilising stored fat, re-establishing glucose homeostasis, and improving glucose secretion through increased beta cell proliferation. Another possible mechanism by which breastfeeding has its positive effects on cardiovascular disease is through the secretion of oxytocin, which is an essential hormone in breastfeeding. Oxytocin has recently been demonstrated to exert positive effects on the cardiovascular system, including blood pressure lowering effects, glucose lowering effects, antioxidant effects, inhibiting inflammation and lowering body fat mass. Breastfeeding might also modify cardiovascular risk through positive changes to the stress response and the autonomic nervous system. So in conclusion, what have we learned from this study? Well, we've learned that this study has strengthened and expanded the evidence of lifetime benefits of breastfeeding in women who are at a higher risk of cardiovascular disease, specifically women with a history of type 2 diabetes or a history of gestational diabetes. We know that women in these groups carry a higher lifetime risk of cardiovascular disease, and breastfeeding may help to mitigate some of that risk, which is great. For me, this does change my practice. I'm certainly going to add it to the list of benefits that I will discuss with women who attend, who are considering breastfeeding and who have a history of either type 2 diabetes or gestational diabetes. So for me, this was a really useful article. I'd like to thank you for joining me today, and I hope you found this video useful. And I'm looking forward to seeing you again soon on GP Notebook TV.